Hi guys, I'm Emma Ryman. I'm a junior and I'm a speech path major.
And I'm Kaylee Flynn, and I'm also a junior and a speech path major.
And today we're going to be talking to you guys about traumatic brain injuries. So, a traumatic brain injury happens when a sudden external physical assault damages the brain and affects how the brain works. A TBI is a major cause of death and disability in the United States. Anyone can experience a TBI, but data suggests that some groups are at greater risk for getting a TBI or having worse health outcomes after the injury.
Traumatic brain injury is a leading cause of death and disability in children and young adults in the United States. Hi, I'm Dr. Griffin Rogers, Director of the National Institute of Diabetes, Digestive, and Kidney Diseases at NIH. My colleague, Dr. Walter Koroshetz, Director of the National Institute of Neurological Disorders and Stroke, explains.
Yes, traumatic brain injury results from a blow or jolt to the head that causes changes within the brain. This type of injury can happen after a fall, a motor vehicle accident, or even a sports-related concussion. Symptoms can be mild to severe, depending on the extent of the damage to the structure and function of the brain. Post-concussive symptoms can include headache, confusion, and blurred vision, along with sensitivity to light, problems concentrating, or nausea and vomiting. Most traumatic brain injuries are mild and short-lasting, but anyone with ongoing symptoms should seek medical attention right away.
Follow us on Twitter at NIDDKGov.
So we're starting off with a presentation overview, and we're first going to talk about the classification of traumatic brain injury, which can include things such as severity, and then we'll talk about common causes of TBI, and we'll move into the effects that TBI can have on the brain and the body, and then we'll talk about ways that we can prevent TBI. So this kind of just shows the difference between traumatic and non-traumatic brain injury. They're both acquired, but non-traumatic involves things such as stroke, tumor, injection, oxygen deprivation, whereas traumatic brain injury is things such as falls, assaults, or motor vehicle accidents, or even sports and recreation injuries. So this is also another part of the classification. So closed is non-penetrating injury to the brain with no break in the skull. And it's rapid forward or backward movement that bruises and tears the brain tissue and blood vessels. And this is usually caused by car accidents, falls, and sports. And this is also what happens during shaken baby syndrome.
And then with a penetrating traumatic brain injury, it's open head injuries, which happen when the skull is open, such as a bullet piercing the brain. And then another part of the classification, healthcare providers look at the Glasgow Coma Scale, which is a point system that's used to describe the levels of consciousness after the brain injury. They look at the eye-opening response, the verbal response, and motor responses of a person. And this just kind of helps them describe the severity of the brain injury. And so with a mild traumatic brain injury, the person is awake, their eyes are open. Symptoms can include confusion, disorientation, memory loss, a headache, and a brief loss of consciousness. So that's 14 to 15 points on the GCS. So they look at your eyes, they're open and blinking. Verbal responses, people are oriented, they're confused with conversation, but they're able to answer questions. Their motor response are obeying commands for movement, and if they're touching you where it's hurting, then, and you're responding, then that means your brain's working with that pain. And then with moderate traumatic brain injury, the person is lethargic, eyes are open to stimulation, loss of consciousness lasting about 20 minutes to 6 hours, some brain swelling or bleeding causing sleepiness, but still arousable. So this is 9 to 13 points on the GCS. So their eyes are open to verbal stimuli, command, and speech. Their motor response is to pain only. They have purposeful movement to pain. They also answer questions, but they're still very confused with their responses. And then looking at a severe TBI, the person is unconscious, their eyes do not open, even with stimulation, and they have a loss of consciousness lasting more than 6 hours. So that's 8 points or less on the GCS. So their eyes have no response to stimulation. Their motor response, they have extension response in response to pain. But they could also still have no response to that pain as well. And then looking at some common causes of TBI, there's a really lengthy little table here that shows a bunch of stats about the 2018 and 2019 outcomes of TBIs, different age ranges, and also just the different effects of a TBI as well. There's also a link to this data table and other tables showing causes and severities and stuff like that. But the most common causes are falls, firearm related death, car crashes, assaults, and recreational injuries.
And then the effects of TBI, it can vary from not really severe to extremely severe, and risk of death from unintentional injury doubles following a moderate to severe traumatic brain injury. I just thought that was something interesting to include. So some of the effects could be cognitive deficits, motor deficits, perceptual or sensory deficits, communication and language deficits, functional deficits, and social deficits. And there can be personality changes, regulatory disturbances, or even epilepsy. And then this just kind of shows traumatic brain injury and how it affects different parts of the brain. And on the left is a healthy brain, and the right shows the brain when there's a TBI. So it kind of just shows like frontal focuses on concentration, problem solving, and speech. But when there is a brain that has had traumatic brain injury, that frontal lobe is showing lack of focus, irritability, and language difficulty. So that's kind of what this table is showing.
And then some effects of a traumatic brain injury relating to speech pathology would be more with the verbal responses. So you can get aphasia. So people have difficulty speaking and understanding speech. They choose words incorrectly or inappropriate words in response to questions and stuff like that. Also difficulty with reading and writing, problems with pragmatics, semantics, syntax, morphology, and phonology, and also memory deficits. And then relating to audiology, a TBI can cause a range of problems related to the ear, including hearing loss, vestibular effects, and central auditory problems. So with hearing loss, they may cause concurrent damage to the auditory pathway. And it can also result with balance issues as well. Damage can occur at any point within auditory pathway from the outer ear to the cortex, which can result in a variety of complex symptoms.
Okay, so now we're going to talk about prevention with TBI. So this kind of focuses on some of the main causes. So older adult falls is a big one. And some recommendations would be talking to your doctor about fall and risk prevention, strength and balance exercises, and having your eyes checked, as well as making your home safer. So that can include getting rid of things you can trip over, installing grab bars inside and outside of your tub or shower. And you can put in railings on both sides of your stairs, or even add brighter light bulbs. And then this is how we can prevent TBI in sports safety and recreation. So something that could happen with younger athletes is changing the win at all cost mentality. And that also applies to older athletes as well. But I think that it kind of starts at a young age. You talk to young athletes about concussion safety, as well as modeling, expecting, and reinforcing safe play. And we included this app that we found from the CDC. It's called Heads Up. And it's just an interesting app for kids. And it's a game for them to play, but also for them to learn about traumatic brain injury. So I'll just read a little bit about what they said about the app. So children must keep their players safe by avoiding obstacles that could lead to concussion, and make smart choices about resting players who have a concussion. When players are injured, the game stimulates concussion symptoms, making the screen blurry and play more challenging. At the end of each level, a doctor checks out all of the players to make sure they are healthy to race and their brains are rested and recharged. So then I just included a couple more pictures of the app. So for example, this says, skate through galactic worlds and collect power gems along the way, but be safe and protect your brain to help your team win. So it's obviously a fun way for the kids to play, but also it's teaching them something. And then on the right, it shows, it says, watch out, things might get blurry if you don't rest your brain, and tell a grown up after you get hurt. So it's kind of a way for them to play, but also see the things that they should be doing in case they did have an injury in real life sport or recreation activity. So I think it's kind of interesting. And then lastly, with motor vehicle safety, There's some things we can do to prevent traumatic brain injury in this area. So seatbelts should be worn on every trip, no matter how short the trip is, as well as buckling children in age and size appropriate car seats, booster seats, and seatbelts. And so with that, kids ages 12 and under should be properly buckled in the back seat. And also choosing not to drive after drinking alcohol or using drugs is a very important way to prevent traumatic brain injury as well.
Yeah. Thanks for listening.
Yeah, if you guys have any questions or anything, just let us know. And then you can always look at the data that we posted and like the link with that too.
Yeah, so all the extra resources will be on the next slide. I don't know if I'm gonna just show that after, but you can also check those out too if you have any questions regarding traumatic brain injuries or want to look at more of the data tables, or even download that app on your phone if you want to play a game or something.
Okay, thank you guys.
Thank you guys.